part of our extraoral examination, the first part of our extraoral examination is to do a facial inspection. So what I like to do when I see a patient is to observe if there are any lesions on their face, any abnormal different colors of their skin, if in fact there's any rash in and around their face, if their eyes appear to be even, and if they're grossly symmetrical. I'll also briefly look at their ears as well as their hair to see if there's any significant loss of hair or any changes in their ear. It's very important in patients that have been sun exposed to understand that basal cell carcinoma is sometimes often seen on the face as well as in the lower lip area as well as in the helix of the ear. The next part of our extraoral examination will be to examine the patient's lymph nodes. As a reminder of anatomy, we will take a look at the anterior cervical lymph nodes, which are anterior to the sternocleidomastoid, as I'm pointing, as well as the posterior cervical lymph nodes, which are posterior to the sternocleidomastoid. We'll also palpate underneath in the submandibular glands, in the submandibular area, and we'll palpate for enlarged lymph nodes around there. We'll also palpate in the supraclavicular area to make sure there are no enlarged lymph nodes in that area either. Finally, we'll palpate the occipital area and the occipital region, that is the back of the head, the back of the skull, to palpate for any occipital lymph node swelling or lymph node enlargement. A lymph node examination would take place as we palpate from the beginning of the sternocleidomastoid up during the anterior cervical region, holding the patient's head steady up to the angle of the jaw, and then move forward to palpate and see if in fact there are any swollen lymph nodes. And in this case, there are none. Supraclavicularly, we'd like to identify the clavicle and press in and around the area once again to feel for any enlargements. Finally, in the occipital area, we'll ask the patient to just nod their head just a tiny bit and palpate in the posterior neck region once again for lymph node enlargement. During the head and neck examination, we'd also like to perform a thyroid examination, at which time we'll have the patient naturally extend their neck just slightly. We'll identify the cartilaginous tissue in the neck area, and we'll palpate on either side of the laryngeal cartilage. We'll palpate for, first, enlargement of the thyroid gland, and also palpate to see if there are any nodules that are present. In order for us to be able to palpate a thyroid nodule, it often needs to be very large and somewhat close to the surface in order for us to be able to identify it as a nodule. Often we'll have our patients swallow, and we will feel the thyroid gland move, which assists us in our palpation of the thyroid gland. For the third part of our extraoral examination, part of this actually takes place intraorally, and that is when we palpate the salivary gland tissue. However, the first portion of that examination is actually to inspect the patient for swelling in the submandibular areas as well as in the parotid areas. Sometimes it's much easier to see the parotid gland when you are looking from behind the patient to see for swelling. This is the gland that used to be swollen when patients had mumps. I will show you the process of palpating the glands during the intraoral examination.